Hey everybody, this is Dr. Richard Alm here in the Columbus Chiropractic Rehabilitation. We wanted to go over another therapy that we use in the clinic. This one is actually incredibly powerful because it's not just used for treatment, but perhaps more importantly, it's actually used for assessment as well. And that's called the McKenzie Method. So I've been using this now for 10 years. This is an approach that each of the docs here at CCRC uses. And recently, last month, I actually studied and became one of less than 200 chiropractors in the country certified in the McKenzie Method. So it's really important here, and we want to kind of go through and explain to you guys the value of it and really show you how we use it in clinic. The McKenzie Method, to me, or what's sort of life-changing or clinic-changing for me, is really two things. One, it enables us to be incredibly patient-specific. So the line I always say is, we want to have patient-specific treatment plans, not rehab not condition-specific treatment plans. McKenzie enables us to do that, and we'll kind of explain that in detail here in a second. The other one that is a little bit counterintuitive for, certainly a chiropractor and definitely the rehab profession in general, is the main goal with McKenzie is to establish what we call clinical independence. And that's fancy talk for empowering the patient to be able to take care of themselves, breaking the connection or the need or the dependence on the therapist, which sounds very, very weird. But I think that should be the standard for all high-quality rehab, all high-quality medical care, is empowering the patient to take care of themselves. And that's a huge part of what we do. So when we go through the treatment plan in the beginning, the education piece is central. They need to know what's going on with their condition. They need to know the things that they're doing in their everyday life that affect that. They need to know the likelihood that it comes back. And if it does, they must know how to put that fire out on their own. Now, that doesn't always happen where they can fix everything that happens later on, but that is a central piece to McKenzie. We don't want them to sort of come in and we can bestow our healing hands upon them. We want them to be an active participant in the treatment plan. So that is, in the acute phases, that is them consistently doing their exercises, consistently changing their lifestyle maybe to accommodate their injury, to help us help them, if you will. And then at the end, they need to know what they have to do to minimize the likelihood that their injury comes back. And if it does, they need to know how to treat it themselves. So that's a really, really important concept that McKenzie preaches that we wholeheartedly believe in here. Let's go back to the original point, which was we can be very patient-specific in the treatments. So I'm actually I'll bring Dr. Kraft in here. Let's say he's suffering from low back pain. You're going to lay on your belly here, buddy. We're going to use an example of, say, low back pain with sciatica down into the right leg. We obviously treat a lot of spinal disorders here, amongst other things. But the McKenzie Method probably became famous in treating spinal disorders and actually was originally discovered with sciatica into the leg. So we'll use this as an example. What we're going to do during the evaluation is take the patient through range of motion testing. We'll, of course, do muscle testing and maybe reflexes and other things that we need to do to get what we call a baseline so that we can always go back to that and see how the patient responded. But the McKenzie evaluation is going to involve repetitive end range loading of whichever joint we're assessing. In this case, we're assessing the lumbar spine here. And what we're trying to find with this evaluation is what we call the movement or the direction of preference. Direction of preference is a very, very well-researched and supported concept, but essentially what it is the direction of preference is the direction in which the joint likes to be moved that improves the mechanics of that joint and reduces the patient's symptoms. If we can find the direction of preference, we know two things. We know, one, we can help that patient, and two, we can help them in a much shorter timeline than if we couldn't find a direction of preference. So today I want to just take you through a very, very brief example of how we would implement a McKenzie evaluation to establish this patient-specific treatment plan. So we would know the symptoms, say low back pain across here, down the right leg, say into the calf. We would lay the patient down, bend down on his belly and say, hey, how are you feeling? Where are you feeling that? He might say, oh, okay, now it's really only into the hamstring. It's not so much in the calf in this position. Great. Now we're going to start the motion assessment. So let's have you come up on your elbows there, buddy. Great job, great job. This is more of a mid-range position, and this is what we would call a static position. So here we're starting to apply an extension force, right? This is extension of the spine, extension force to the spine. And then we're just going to ask him, hey, how does that feel? And he might say, it feels great. He might say, ooh, there's a lot of pressure in my low back here. He might even say that now the pain goes into my calf or in my foot. That's called peripheralization. This is something that we're looking for. We don't want the pain to move away from the spine. We want it to move towards the spine, which is called centralization. So in this position, we're going to just assess how he responds to this force. It's basically dose, response. So go ahead and lay back down. We'd say, okay, how do you feel now? And you say, oh, it actually feels better now the symptoms are up into my hip. That would be an indication of centralization. We like that. Okay, so now that we know that mid-range extension is safe, that he can kind of tolerate that, now we want to progress slowly towards end range, making sure that we're being safe and protecting the patient at all costs here. So we're going to have you do just like a normal press up here. Just go ahead and press all the way up, nice and easy, and then back down. Do one repetition there. When you did that, what did you feel? He might say, ooh, more pain in my back and more pain in my hamstring. And then I'd say, how do you feel now? And based on what he says, that's going to sort of dictate what we're going to do next. Today, we're going to go with the classics. So he did one rep. Let's say it produces symptoms, and now he feels okay. So we would call that produce no worse. And we're going to have him now do this repetitiously. So let's have you do 6 press-ups for me, buddy. So we'll do a press-up and back down. We're extending the back the whole time that he's doing this. And as he's going, we're actually going to ask him, hey, what are you feeling? You know, what symptoms are you getting? Is it getting worse? Is it getting better? Is it going down the leg? Is it going into the back? Wonderful. I think that was 6, right? Right, close enough, right? So now we watched his symptoms during, and we want to assess afterwards. Sometimes that movement might make him worse. Sometimes it makes him better. This is the patient-specific piece. Today, that made him better, let's say. So, okay, now I have no pain in my hamstring. He complains of more hip pain maybe, more back pain. Even though it's increasing his symptoms, because the symptoms are moving this way, we know that that's better, that's centralizing. Another piece that I'm not going to show today is we would, of course, in between all of these, go back and look at the baselines. We might check his reflexes. We might check his muscle strength. We would check his active and passive range of motion. We're going to palpate the tissue to see how does his body respond. So we're going to use a combination of subjective and objective measures so that we can definitively know that he is responding well to these movements. Okay? So he got better here. Got a little bit of this. Great. Now let's go ahead and let's try another set here. We're going to do 10 sets. We'll do 6 today. 10 sets of 6, right? So we would have him maybe do this again and see if we keep getting progress with this exercise, we may just stop here and know that, oh, extension is the direction of preference. Okay, go ahead and take a break for a second. I know that was not 6. But let's say that he just keeps getting better, or maybe we need to add a little bit more force to get the results that we're looking for. Now is the place where the clinician can kind of come in and actually maybe add a little bit of gentle force to hopefully get the results that we're looking for. So let's go ahead and have you do a press up. I can just gently get in here and add a little bit more force this way, right? This is a little bit of what we would call overpressure. So this is extension and lying with clinician overpressure. Good, nice and easy. Go ahead and relax. So that's just an example of how we can increase the force, and finding the direction of preference, finding the exercise that gives them the best results, the best relief, the best improvement in their mechanics is what we're looking for. So that is kind of a basic intro to what you might see if you came into the office, in this case for low back pain. Guess what? We can do the same thing for thoracic spine. We can do the same thing for cervical spine and every other joint in the body. So the McKenzie Method, with this repetitive end range loading and always going back to baselines and checking what is the patient's response to that, can be applied anywhere. So it's an incredibly powerful tool. We use it on virtually every patient that walks in the door, so it's a central part to the practice here at CCRC. I just wanted to take just a couple seconds to explain that. So now the only other piece that we would do is the patient participation at home. Once we've found the direction of preference, guess what? We found our exercise. So now we're going to send Ben home with whichever exercise we thought produced the best results. In this case, it was repetitive extension and lying. So we would give him a full explanation on one of these nice whiteboards here, explaining how his posture affects this, or some of the movements or lifting. We might modify some of his exercises. And then we're going to have him do this exercise repetitiously so that he's able to continue progress and continue the treatment when he's at home. He's not just getting treatment here and then going home and the rest of the day he's just, doing his thing. We want continuous work on this process so that we can get the fastest results possible. So that's kind of like what the exam looks like. That's what we would be doing at home. That's a very, very short intro to what I consider to be one of the most powerful techniques on the planet. So if you have any questions, go ahead and sort of click below or email us, and we'd love to sort of answer some of your questions. Talk to you next time.